I actually want to dive deeper into it. And we talked about you sharing and showing us what it looks like and
Sure.
what these groups are, how do you manage, and what do you guys even talk about?
Everything. So we started off with swag, right? I'll be happy to share and show some of these things. So right now we're at 253 members. So anything and everything. Like if there's a question, we'll ask them. Right now we're talking about ergonomics, and the physical therapist told them you have to sleep with so many pillows. You can't keep your elbows bent. I said, who's taking the obesity boards? And do you all have some, a letter to give out to primary care physicians? Similar discussions between swag or sagi, one of them, right? And how do you get involved with some advocacy issues? So there's anything and everything, nothing is taboo. So we've been talking about that. And then we go to sagi. We have, we called it practice management because it was going to be only practice, and we didn't want anything to be distracting. There was, if you start talking about anything and everything, then the WhatsApp group gets really confusing. So we didn't want that. So in Sagi now, of course, this is purely practice management, and we have all these people, 624 members. And yesterday I was at a conference and we were talking about reimbursements, and you can see this was a sad slide, as people said. And they have, like, how what is going on with the gastroenterologist, and there is a lot of discussion when somebody posts something about it. Then we had a vendor call yesterday where some people are looking into some of these AI based applications for practice management. So we vet a couple of vendors, three or four, whoever is in that space. As group admins, some of us do that, or if somebody had experience with a particular company, they will come and approach me on how we can introduce it to the group. So both sides benefit. The vendors getting exposure, and different groups, they just attend an hour call, and we'll have two or three vendors which we can talk more about, ask questions. So that's evolving into a very useful kind of place. And these are some of the discussions. This is like what I learned yesterday about the decrease in the RVU with the efficiency cuts. So that was some information that was presented in a good format, and we shared that. And anything and everything can be talked about. And this is Dr. Sharma, Pratik Sharma, got a Padma Bhushan. So we want to, congratulate ourselves when somebody becomes an ACG fellow
For
or governor.
context, Neelima, for context for the audience, please say how important Padma Bhushan is in India.
Yes, yes. So this is the highest honor that you can receive in India. And this was Dr. Pratik Sharma was the ASU president, and he has done some volunteer work in India through the government of Andhra Pradesh. So this is the president that is recognizing him in New Delhi, along with all the famous celebrities. So it's an amazing award, and somebody like one of us is getting that is something we're all proud of, and that's why we were able to showcase that, and everybody that knew him, didn't know him, had congratulated him. And you can see these are all some of the discussions that we have in the group, from day to day practice to management to revenues, how we have to fight the current environment with the blood tests, stool tests. There's no end to it.